This is CBC Winnipeg News.
Good evening. Thank you for joining us. We are less than a year away now from the next provincial election in Manitoba. And now we have a sense of what the Progressive Conservative government will try to accomplish before that date. The throne speech was read today. It outlines the government's priorities for the year ahead. CBC's Ian Fraze has the story.
Manitoba has been sending people who need surgeries and diagnostic services to other provinces and American states. Today, Premier Heather Stefanson says that's a sign Manitoba doesn't have enough private healthcare partners here, like the Maples and Western surgical centers. Stefanson was responding to perhaps the most eye-opening part of her government's throne speech today. The speech outlines her government's priorities for the coming year. It says other provinces have a blended public-private health delivery system that works, and Manitoba can learn from them.
You look at other provinces, they have expanded beyond. They have a significant private sector component that they contract out to within their provinces. We have lagged behind.
Doctors Manitoba President Dr. Candice Bradshaw says she's fine with the number of private facilities already in the province, but until she learns more about the government's plans, she'll reserve judgment.
We already have some private facilities in the city, and a lot of us, for example myself, as a primary care physician, work in a private clinic within the public system.
Like all throne speeches, many of the details are still to come. But here is what we know. One of the province's promises is a multi-year, multi-billion-dollar capital investment into hospitals. HSC has been cited as a possible example. There's a pledge for 1,000 new addiction treatment beds, more money to give cops to help them fight gangs, more cameras downtown to help police with their surveillance efforts, and a new teacher registry and oversight body so the public can find out if a teacher has been investigated for misconduct. And here's something noteworthy for not being in the speech. There's no mention of making funding for post-secondary schools contingent on certain performance measures. Stefanson says the government is backing off on that idea. Ian Fraze, CBC News, Winnipeg.
Well, voters in the provincial constituency of Kirkfield Park will head to the polls a bit sooner than that provincial election next year. They will vote in a by-election December the 13th. That West Winnipeg seat has been vacant since former Cabinet Minister Scott Fielding resigned on June 17th. The necessary documents for that by-election were signed today. Advanced voting will be held from Saturday, December 3rd through Saturday, December the 10th. Winnipeg's Children's Hospital Emergency Department continues to see an alarming number of sick kids with respiratory viruses. There were 198 patients who needed care there yesterday, according to Shared Health. This morning, there were 10 patients in the pediatric intensive care unit, which is one over the usual capacity. And Shared Health says there were 52 babies in the neonatal intensive care unit, including a number of infants who are in isolation because of a respiratory illness. The province plans to give family doctors and community health clinics incentives to open longer, but some doctors in our province say it'll take more than money for that to happen. Andrew Wilds has the story.
Hospitals for emergencies, family doctors and clinics for less serious sicknesses. It's one of the proposals under Manitoba's new health plan. The province says it's willing to pay doctors more to work evenings and weekends. Dr. Travis Byron says some financial incentives are important.
Manitoba did pay for the cost of my move to move to Manitoba, and that helped. In fact, I would not have had the means to move here without that incentive.
Dr. Byron says opening more hours may be possible if the incentives cover the whole team.
You're going to need maybe a nurse, certainly a clerical staff, and I would hope and expect that there's some incentives announced by the government insofar as, you know, not only incentivizing the doctor, but incentivizing the entire clinic.
Dr. Joanna Lynch says money is not the issue. It's time.
They're putting in 10, 11-hour days, and in some cases, you know, visiting patients in hospital or the personal care home on their way home from work. And honestly, 2 to 3 hours worth of paperwork on top of that every evening.
The province says it's creating a task force to cut down on that paperwork. Financial incentives for doctors to work evenings and weekends is just one of many ideas proposed. The province says the details of the plans are to be worked out. It's not yet clear when those details will come. Andrew Wiles, CBC News, Winnipeg.
And still on the health front tonight, nursing regulators in Manitoba have lowered some of their English proficiency requirements. That is in an effort to increase the number of nurses working in our province. This comes after critics said that those scores were preventing some Indigenous nurses from practicing. Tamara Keeper is from Tatasqueyak Cree Nation. She says despite being fluent in English, she did not get a passing score. She hopes it means she can now become a registered nurse.
There was a lot of frustration, anger, injustice. It felt like at one point I felt like, am I a nurse? Am I a nurse if I don't have an RN status?
Keeper says she looked at a number of professions and only nurses required that English proficiency exam. She says the requirements make no sense, particularly for nurses who are educated in Canada. A Winnipeg institution has closed its doors for the last time. KUB Bakery shut down today after 99 years in business. Ross Seinfeld and his team baked their last batch of their famous Canadian rye bread. It has been a staple in Manitoba grocery stores, on countertops, and of course at socials. Seinfeld says the pandemic, the war in Ukraine, labor shortages, and other factors made it too challenging to continue operating. His late father Jim bought that business back in 1982, and Ross and his two siblings have been running it ever since.
They said, don't miss a moment. Stay in the moment.
Well, that's an excited Winnipeg Blue Bombers football team. They're boarding a plane for Regina. The team left for the Grey Cup late this afternoon. Quarterback Zach Collaros is named to his second straight CFL All-Star team today as well. The Grey Cup celebration kicked off in Saskatchewan today. That football game against the Argonauts, of course, taking place on Sunday. Here's a look outside tonight. Meteorologist John Sauder is in next with our forecast. Stay with us.
This weather update is brought to you by Capital Ford Lincoln. 22 model clear out is on now.
Did you see that sunshine today in the Red River Valley early in the day anyway? Well, I hope you had a chance to get outside and enjoy it, because the next few days are going to be pretty gray. We've got several bands of snow moving through. Nothing that is like last week where we had 20 centimeters, 30 centimeters in some areas. Just occasional light snow or periods of snow across the north, even on Wednesday. So the entire province under cloud cover tomorrow. Snow here and there, and I think that over the next few days we might pick up 3 to maybe 5 centimeters in southern Manitoba. Thursday also brings in some pretty gusty winds, so any new snow that falls will likely get blown around on Thursday. Winds out of the northwest gusting to 60 in the afternoon. This is the next 48 hours. It takes us all the way to 4 p.m. Thursday, 3 in Kenora, couple in Winnipeg, maybe up to 6 around Portage. So no huge amounts. Still occasional shoveling to do between now and the weekend. Cooler tonight, -14. The morning tomorrow is mainly cloudy. The snow starts pretty early in the day. Not a whole lot of wind, -6 the high. And then in the long range, we get some blowing snow around on Thursday, more periods of light snow Friday. Cooler but brighter as we head into the weekend.
Thank you, John. That is your late news for this Tuesday. Thanks so much for being with us tonight. We'll see you tomorrow at 6 and 11. Have a great evening.